Today we are talking about the medicine thiazide group. Now we must know thiazide fall under diuretics, and what we'll be talking about will be hydrochlorothiazide, chlorthalidone, and metalazone or metose. Now these are very common drugs. We very commonly use this drug into Telma H, Telista H, or Telma CT or Telista CTD or Metexel 3D. So all these drugs have this hydrochlorothiazide or chlorthalidone, and metalazone is also very commonly used thiazide. Now we must know that these are medium efficacy. Now who are high efficacy? High efficacy is furosemide and torsemide, that is Lasix, Ditor, Ditor plus Ditor means furosemide and torsemide. These are high efficacy, these are medium efficacy because these medicine cannot cause significant diuresis. Now, why we call it as medium efficacy? It all depends on diuresis. Whatever amount of urine is produced, on that basis, we label that patient, we label the efficacy to be high efficacy or medium efficacy. That furosemide, torsemide, these medicines can cause increased amount of urination. They can produce profound diuresis. That is the reason why they are high efficacy. And these medicines, they are medium efficacy because they won't produce large amount of urine. Lasix, torsemide can produce up to 10 liters of urine output per day, but these medicines will not cause that much of diuresis. Now, these medicines actually act at cortical dilating segment or early distal tubule of the nephron. We must know that nephron has the glomerulus, proximal convoluted tube, Henle's loop, and the distal collecting tube. So and then it is all collecting system. So these medicines act at the distal collecting tubule. So the site of action is between the thick ascending loop of Henle and late uh, distal collecting tube. So this is descending and this is ascending. So these drugs act at this later portion of the nephron where they act and they have this diuretic effect or the diuretic effect. They doesn't cause significant alteration in acid base balance, so they won't cause acidemia or alkalemia a lot. These thiazides, they reduce the blood volume and they also reduce intrarenal hemodynamic changes. That is the reason why they tend to reduce the glomerular filtration rate. That is the reason why these medicines are not effective, especially if the glomerular filtration rate is low, because these medicines already reduce the blood volume. And if the GFR is low, suppose if the patient is in CKD stage 5 or stage 4, where already the glomerular filtration rate is very less, then this medicine won't work at all. So the hydrochlorothiazide, chlorthalidone won't work if creatinine is very high or if the GFR is very low. The features of this medicine, the thiazide group, is they reduce the renal calcium excretion. So it will simply increase the blood calcium levels, and they increase the renal magnesium excretion. So they will cause hypomagnesemia. Very commonly, as we know, the first priority of the body is to save the sodium. Sodium is very important. So body won't let the sodium go outside. So sodium is again taken up, and instead of that hydrogen is put at bait. But again this hydrogen is very much required for strict acid base balance. That is the reason why this H plus is again reabsorbed, and against that potassium is lost. So potassium is the least favored ion among the cation by the body. That is the reason why potassium loss is maximum with the thiazide. That is the reason why there is hypokalemia, and hypokalemia reduces the insulin release, and the reduced insulin release then causes hyperglycemia. That is the reason why thiazides will cause hyperglycemia. So they will cause reduce calcium excretion, they will increase magnesium excretion, and they tend to cause hyperglycemia without much change in acid base balance. These medicines won't cause drastic fall of blood pressure within few minutes or few hours. So they have slow developing fall in BP. That is the reason why we simply start these medicines as a maintenance dose or as a blood pressure lowering medicine, but in a maintenance form, so that the blood pressure should be controlled after 3 days, 4 days, 5 days, 6 days, 7 days, 8 days, over a period of time. And these medicines are available only in oral form. These medicines are not found in IV form. That is not the case with like furosemide or torsemide. Both the medicines come in tablet as well as injection form. The action of these thiazides, they start within 1 hour. The duration of action is 6 to 48 hours. So for hydrochlorothiazide, the duration of action is around 6 to 12 hours. This is hydrochlorothiazide is very commonly seen. It is with like Telma H, Telista H, or Telista CH, or Telcure CH, or Orcure CH. So H, wherever H is there along with the telmisartan, then that is hydrochlorothiazide, and it acts for around 6 to 12 hours. For chlorthalidone is extremely long acting. The half life of the drug is around 40 to 50 hours. So it is exclusively used as an antihypertensive medicine, because it can slowly, gradually control the blood pressure over a period of 2 to 3 to 4 days, and the blood pressure lowering effect of this medicine lasts for around 3 to 4 days as well, very easily. The one of the interesting drug in this class is metolazone. So metolazone, the feature of this medicine is that it is useful even in very very severe renal failure. That is, even if the glomerular filtration rate is less than 50 ml, 15 ml per minute, this medicine can still help to cause urine output. So this drug characteristic feature is very commonly used. Any patient, if the urine output drops, if it is not responding to suppose furosemide, torsemide also, that time metolazone is added in 2.5 twice a day or 5 milligram twice a day, so as the urine output can be achieved. So this metolazone has marked additive action when it is combined with furosemide. That is what I just told. And 2.5 milligram to 5 milligram twice a day is used, and mainly it is used for edema and oliguria, because whenever we say that the urine output is reduced, that time even if the other drugs fail, metolazone can help to start the urine output. So this hydrochlorothiazide, most of the time, most of the drugs, they it is given in 12.5 milligram to up to 25 milligram. 100 milligram of hydrochlorothiazide is hardly used by any, because most of the combination, it comes with telmisartan, and it is usually 12.5 to 25 milligram per day. The duration of action of this hydrochlorothiazide is around 6 to 12 hours. For chlorthalidone, most of the time 6.25 to 12.5 is used with the double combination or triple combination medicine, and the duration of action is around 48 hours very easily. The effect of chlorthalidone can very easily last for around 3 to 4 days. And metolazone, most of the time it is used in the dosage of 2.5 milligram twice a day or 5 milligram twice a day, especially if the GFR is less than 15 ml per minute, when there is severe renal insufficiency, when furosemide or torsemide, they are not able to generate the urine output, or edema is there, or reduced urine output is there, and the duration of metolazone action is around 12 to 24 hours. So this was all about thiazide. We'll meet again. Thank you.